Today we'll talk about important things to know about teeth development in children. What important things we need to check? Follow some guidelines. What can they eat?
First of all, you need to go to your dentist with your kid on his first tooth, because the dentist can inform you, can explain you about toothbrushing in children, about using toothpaste or not using toothpaste.
Wait, first tooth, you mean when he's younger, 8 months old?
Something like this, yes.
Okay.
The doctor will explain you how you need to properly take care of your child, to brush his teeth with toothpaste, without toothpaste, with what kind of toothpaste, with what concentration of fluoride, if your kid is high risk or low risk, everything can be seen.
I thought it's a common sense to brush their teeth with the Tom and Jerry toothpaste.
Yes, I don't know if they have all around the globe Tom and Jerry toothpaste. You're 35 and you still brush your teeth with Tom and Jerry toothpaste.
You see? And it works. Now,
as your dentist, I'm not sure it works.
how about all the things that they did to us when we were kids? Like when your tooth is almost falling out, so they
beat you up until it falls.
No. So they just they tie the tooth to some string and tie to a door and all this masochistic stuff that our parents did to us.
If you want to have a lot of views on TikTok, it's the best thing that you can do. You just tie the tooth to a
doorknob,
or a Nerf gun, and you shoot the tooth away.
So if kids have
they did that.
If kids have
they have videos.
If kids have movable teeth, so just give them an apple and wait for it to fall by itself?
When the permanent tooth is erupting, not in the proper place, it's possible that the tooth won't fall right away. So you need to help it, like extract the tooth. But it's not the most important thing. The most important thing is how properly take care of the tooth, and you need for the kid to get used to seeing a dentist, because in many cases in the older ages, when a kid or grown-up have a phobia from dentist, because of that, because he didn't have interaction with dentist in the younger ages, and then he is afraid, doesn't want to come to a treatment, and sometimes it's inevitable that you need to go to a dentist. You have problems, you need to take care of those problems.
So the most important, not the most, but the stages are, first of all, take your kid to the dentist on his first tooth.
Yeah, the kids need to get used to the thing that someone is checking him, someone is looking at him, and someone is making sure that everything is fine. Then the parent also need to have some guidance in the process, because you don't always know best about what kind of foods, when to brush, with what brush. There's also this is probably the most crucial thing about tooth treatments, is you need to know what to do to prevent them in the first place.
What about crucial stages? Like at what age it's crucial to go to a dentist? When the teeth starting to move? When the...
No. If you know that your kid have orthodontic problems, then going to a dentist when he's 15 is kind of old. You need to go to a dentist or to an orthodontist in about 6, 7, 8 to see when is the youngest age when we can start some kind of treatment. When in the growth spurt, when the kid is growing, it's much easier to treat some kind of problems.
And not when you are 30, married, with 4 kids, and someone is telling you that you need to put a bridge or something.
Exactly, that's a problem. So you can use the growth spurt. You can use all those stages in the growing part of the kid to your favor, to help to make the treatment as easy and as good as possible.
Look at this kid, how happy he is to see a
very
dentist.
happy. First of all, start brushing the teeth of the child even before he has any teeth. Because you need for him to get used to the fact that someone touching his gums, someone is opening his mouth. Later on, when he'll have some kind of teeth, it will be much easier. Then you brush your kid's teeth twice a day. In the evening, after brushing his teeth, you don't give him anything except water. Most of the cases when you have caries in younger children, it's because of improper diet. You're giving him things to eat, you put him to sleep with syrup water. It's wrong, or 7-Up. Sugar for teeth is awful, and when you sleep and you give him sugar, it's the worst thing that you can do, because the saliva don't clean the teeth and the sugar stays there, and the first teeth that the kids have are much more susceptible to caries. They're much easier to be infected.
That's the question. If those teeth fall out anyway, the milk teeth, so why just to say, so be it, and wait till...
If you extract teeth, primary teeth, before their time, you can have later on problems with orthodontics. Everything has its own time. You can't just... So he has another set of teeth, let's extract them all. No, because later on he'll have some problems, he'll have wrongly erupted teeth in wrong times, and it's very difficult to correct that in the older age with a lot of problems with orthodontics, and in many cases you need to extract teeth and already
formed.
Yeah.
So from what you're saying, there is a big correlation between primary teeth and the permanent teeth. You need to take care of them also.
Of course you need to take care of them. It's part of your body. The fact that it falls doesn't mean anything, because if this process is done incorrectly, you'll have a lot of problems, mostly with orthodontics in later ages. So in many cases, even when we extract a tooth before its time, we need to reserve this place. We have different kinds of treatments for the teeth not to move or to hold places for the permanent teeth. It's something that you always need to think about.
Thank you very much.
You're welcome.
And thank you for being with us today. Don't forget to like, share, subscribe, follow to stay tuned with the latest cases. Thank you and have a great day.